all the team members in pain management have a role in helping understand what type of pain patients are having. Unless you can understand that type of pain, it's really hard to treat it. So we together look at an assessment piece where we're trying to figure out chronic versus acute pain. Is it neuropathic or nerve involvement? Are there multiple places where that pain comes from with different types of pain? And the team as a whole is trying to get information to tell us where the pain is emanating from. But probably the most important piece that I play as a pharmacist in that initial assessment is looking at the history of medication the patients have been on. So often we've tried things that haven't been successful, but it's not well documented, or we haven't tried things and no one understands that. So getting a good, solid medication history is part of that assessment. The pharmacist also plays a big role in figuring out how we're going to evaluate whatever management therapies we have. So if the team feels that we're going to use opioids, how are we going to evaluate how well they're working? And then once that's decided, following up with that on a regular basis to make sure that the therapies that we've decided on are working, and if they're not, trying something else and evaluating those therapies to make sure they're working. So those are probably the main pieces that we get involved with. And probably the most important piece, of course, is how we evaluate how well our therapies are working. And we need to, and it's different for each patient. The other thing that I think that we were going to discuss is what I like most about pain management. And I think the best way to elaborate on that would be to give you a scenario, something that happened to me that illustrates it very well. And this was a few years ago, but I think it illustrates it well. There's a patient who had cancer. He was in his late 50s. I believe he had some kind of metastatic cancer of the lung, or something that was had metastasized, but it had pain, and I had to, another way to control that. The only way that we could control it was to put a catheter in his spinal cord and infuse opioids and local anesthetic into that catheter. But unfortunately, when we did that, he was so sleepy most of the time. He was not able to converse with his family, nor was he able to go home. So I was asked, along with some nurses, to come in and figure the best way to get him ready to go home so he could die at home. And we did a very simple thing. We added a non-steroidal anti-inflammatory drug around the clock. And within 24 hours, he was able to converse with his family, and they were able to move him and go home. Now, he died a few days after he got home, but I feel that I made a tremendous difference not only in the patient's life, even albeit short, but also the family's life. There is a resource out there that goes greatly underutilized, and that's your pharmacist in every corner drugstore in America. They understand a lot about pain management and about the medications that can be used for either minor aches and pains or anything, and sometimes things that are more significant. So utilize those people. They're willing to help you if you just ask.